My name is Melinda Gooderham and I am a dermatologist in Peterborough, Ontario. The number one thing we see here is skin cancer and pre-cancerous skin changes from sun exposure. We have an older population in Peterborough, so there are a lot of farmers and people who had too much sun when they were younger, and so most of the day is dealing with skin cancer. Apart from that, I have a special interest in psoriasis. We also see a lot of acne, mostly in teenagers, but sometimes in women. There's also the allergy testing, different reactions to products that people are using or different allergies to things that we need to investigate. This is something called a dermatoscope, so we can put that over different moles and freckles and we can look at them closer, looking for different features of skin cancer. Every day I spend about an hour going through test results as they come in and then acting on them. So when you see the patient, there's a certain patient contact time, but that time then turns into other time of ordering tests, reviewing tests, making changes to the treatment plan based on the test results. We try to streamline it and keep it as efficient as possible. So if there's something that doesn't need to be done by a doctor, like entering medications into a computer, I try to have that done by a nurse so that I can be seeing a patient and making a diagnosis and coming up with a treatment plan, which is what I've been trained to do. So we have 3 nurses. One of the nurses is more specialized for giving the phototherapy treatment and doing the patch testing. And I have another nurse who is a little more specialized in procedures, and she assists me if I need to do a biopsy or take off a skin cancer. And then I have another nurse who helps me more with the research projects. So she's well versed in all of the research that we have going on. So if I have a question, I can go to her and she can help me come up with the answer so that I can use my brain doing other things. After you leave the office, your day does not end. Patient care happens during the day, but all the other stuff, the reading and the writing and the thinking, they all happen outside of clinic hours. Once you're a doctor, you're always a doctor. You're always thinking about your patients. You're thinking about whether you chose the right treatment or did the right thing. There's always something you're learning every day, and then when you go home at night, you're learning from books, but in the day, you're learning from people.